So there seems to be a lot of debate whether supervised consumption sites are beneficial or we should take them out. This has sparked recently within Toronto, the city in which I live, where the government announced that they were closing down supervised consumption sites. So harm reduction, safe consumptions, not where they provide drugs, but where they provide safe tools to use your own drugs so that you don't need to go in the back alley of a school to shoot up heroin or use your other drugs. It's one area where people can go to safely use their drugs. Clean needles, lots of good benefits. However, people see the headlines and think, oh, we're closing down those stupid drug sites where all those dirty homeless people hang out. And I'm pretty passionate about this because I think harm reduction saves lives. And I know a lot of people in my industry agree with that sentiment. I want to spread some awareness on why this is bad. And the government has, yes, pumped in money for recovery. The problem, though, is, and I'm going to get into it in this episode, is not everybody wants to stop using drugs today. That might not be the case down the road, however. And it is my opinion that if you keep someone alive long enough, which is what these supervised consumption sites are doing, these needle exchanges, these sites that we're shutting down, you keep people alive, they reduce overdose deaths to a point where they can hit their bottom. That is the goal, in my opinion. How do I get somebody to get help with treatment and addiction? Well, the only way I know how is to let their consequences happen to them so that they can come to a place where they want to stop. And let's be honest, not everybody will want to stop. Some people will want to go on the rest of their lives using, and they're okay with it. Wasn't my story, wasn't my situation, my scenario. I hated it, every second of it, and I wanted to stop, and I did stop, and I got help to do so. And without rehab, I wouldn't have been able to do it. So I'm going to go over what these new HART Hubs look like in Toronto. And essentially, it's not just Toronto, but this will apply to around the world, because I think a lot of governments are starting to push towards the abstinence-based model, which is great for somebody that wants to stop. But if you don't want to stop yet, I was in that boat for a long time. I didn't want to stop. If we're forcing people to stop against their will, I think it causes more overdose. And I think the data and literature reflects that as well. People are only ready when they're ready, and we can't force them into abstinence-based recovery because it's a big step for a lot of people. They can't fathom abstinence and quitting altogether. So Toronto announced a new strategy. It's called the HART Hub, HART. And its purpose is to connect people who use drugs with treatment, housing, healthcare. And there's a big debate around it because, like I said, the services like supervised consumption and safer supply are not included. So the purpose of this episode is to talk about the opioid crisis in devastating cities, Toronto, the new model that we're trying, and we're going to cover what the HART Hub is, what services it provides, what it doesn't include, the potential benefits, the criticisms, and concerns. And I want to hear your opinion on closing down safe consumption sites and harm reduction. I want to hear what you have to say about it. So comment down below and let me know how you feel. So as you know, Toronto, as like many cities in North America, still faces opioid overdose deaths, homelessness, fentanyl contamination, lack of detox beds, and lack of supportive housing. We're calling it the drug toxicity crisis, which is exactly what it is. It's not a drug crisis, it's a drug toxicity crisis. Our drugs are toxic. People are overdosing accidentally. The key problems people are facing are no access to treatment, untreated mental illness, so there's usually a lot going on below the surface of addiction, no stable housing, limited primary health care. And many people bounce between shelters, hospitals, jails, and the streets. So the HART Hub is meant to create a centralized pathway to care. Oh, here's what it stands for. I was looking for this. HART stands for Homelessness, Addiction, Recovery, and Treatment Hub. So the Ontario government plans 28 hubs across Ontario, and they're pumping in $550 million into investment, into treatment, into this initiative. Has this happened yet? Not sure. I don't think so. I think they're still rolling it out. But as with anything in the government, slow and steady, I guess, wins the race is their motto. I don't know. So the idea is to create a one-stop access point for everyone struggling with homelessness, people who use drugs, and people with mental health disorders. So instead of navigating multiple systems, people can access addiction treatment, medical care, housing referrals, and mental health support all in one place. Beautiful, isn't it? How is the government going to screw this up? I'm sure they'll find a way. So here's the services they offer. Opioid agonist treatment, OAT. So medications like methadone, Suboxone, and slow release morphine. I have a whole episode on OATs when I sat down with Kate Johnson. Geez, I couldn't remember her name for a second there. From CATC. And we break down what opioid agonist treatment looks like. So the second thing they're providing is mental health treatment. The hub includes a concurrent disorders act. So this includes a team of psychiatrists, nurses, social workers, and peer support workers. They treat people who have both addiction and mental illness. Sounds great, doesn't it? It focuses on the third thing, primary health care. Many people using drugs lack basic medical care. So the hub will aim to provide wound care, STI treatment, vaccinations, foot care, and general health care. Now, this is big because a lot of homeless people, unhoused people face untreated medical issues. 4, detox and withdrawal management. So the plan includes 10 withdrawal management beds. This helps people obviously safely detox from substances. And then, 5, supportive housing, another key part. Allegedly, there will be 25 supportive housing units. And as we know, recovery is difficult enough, but when you don't have a home to go to, you don't have one of your basic needs, shelter, how the fuck is anyone going to stay sober? Nearly impossible. Stable housing dramatically improves recovery outcomes. And then case management, the 6th thing, which each client will be assigned social workers, counselors, case managers, and they'll help people navigate treatment, housing, employment, and healthcare. So the controversy, here's where the debate begins. The province requires the HART Hubs do not include supervised consumption sites, like I said, safer supply programs, drug checking. So checking if your drugs are actually what you think they are and not toxic fentanyl doses, and needle exchange services. We're not going to have any of that. So this is a major policy shift. Some harm reduction advocates, including myself, argue that, your overdose risk increases. People may be avoiding the hub. They're not going to go altogether. Harm reduction becomes weaker. I don't want to stop yet. I'm not ready. So I'm going to go use on the street. Why would I go to this treatment hub? I don't want to stop. And then the other side is arguing the focus should shift towards treatment. So like I said, abstinence-based recovery, housing, mental health care, which yes, all good things. But if you're not ready, you're not ready. You're not going to do it. And you can't be forced into doing it. So the potential benefits of this, if implemented properly, the model could reduce ER visits, connect people to treatment faster, improve housing access, reduce overdose deaths. I don't know about that one. Coordinate services that currently operate in silos. So put everything in one place. That's the big thing you hear is it's hard to get connected with everything. And that's the point of a social worker. The biggest strength of the model is the integration of the services, like I said. So instead of fragmented, clients get coordinated care, treatment pathways, case management, all in one place. One-stop shop. The real challenge is the success of the hub will depend upon typical government things. Can the government keep the funding stable? Are the number of treatment beds going to be enough? Housing availability. What are we going to do? Create more houses? We already have a problem with price of houses. Outreach effectiveness and client trust in the system. If the system can't deliver enough detox beds, housing, long-term recovery programs, then the hub could become another overloaded service. And we don't need any more of those. Everything is already full. Evidenced by the 6-month to 8-month wait list to get a OHIP covered treatment bed in Canada right now, or at least in Ontario. So I want to know what you think. What do you think about this policy change, about these implementations? Do you think that closing down supervised consumption sites is the right answer? Do you think we should be forcing people, or, that's a strong word, forcing, but essentially we are, into abstinence-based recovery? Were you ready to quit when you first got introduced to recovery? I know I wasn't. For me, I was given an ultimatum by my family to go to treatment, and it was only in there that I started to discover the recovery message, and I started to listen. I think that forcing people is not the right way to do it. I think that mandating rehab for a lot of people is going to lead to a deeper bottom and possibly an overdose death. And I think the literature reflects that is, and don't quote me here, but the evidence shows that harm reduction is actually the answer to lower overdose deaths. It sounds kind of sinister, but we're keeping people alive long enough so that they can hit their bottom and become the humans, the children of God that they're meant to become. Because again, I've seen people in the lowest of lows become lawyers, doctors. I've seen strippers turn it around, and escorts and sex workers addicted to crack turn into great lawyers in the system and doctors. I've seen it around recovery. There are miracles here, but I think we have to be careful with pushing people into abstinence-based recovery. I was listening to somebody talk on the phone the other day, and they were telling me that their counselor wouldn't work with them because they wouldn't accept abstinence-based recovery. They would only work with people that were ready to quit altogether. And that is a huge disservice. Could you imagine you went to a counselor and they said, "Oh no, I can't help you. You have to quit or else we're not working together." I'm going to go out drinking and I'm going to show that person, fuck them. There must be no way. It's either all or nothing. There's no in the middle. There's no reducing. There's no control. There's no harm reduction. We have to come to the conclusions ourselves that we are now ready to stop altogether. We can't be forced into abstinence because that is a huge mountain for a lot of us to climb. I can't fathom in the beginning thinking, when I went to treatment, they said, "Do you think you're an alcoholic?" I said, no, I'm just a drug addict. I can drink again. And it wasn't until staying in that treatment center long enough, because I had the privilege to do so and I had the support to do so, where I discovered, yes, I can't have one of anything. And I am an alcoholic and I am an addict, and I need to find my own way and my own resolution to this problem through the help of others. Nobody can force me to stay sober. And that's the case with everybody. So let me know what you think. This was a short one today, but I just wanted to touch on this, in my opinion, sad news in Ontario. And I hope that it works out. I hope that the funding is there. And I hope that we reduce overdose deaths and get people into recovery, because at the end of the day, addiction is not going anywhere, and we need more services to help the people that can't access the services. So don't ever forget, recovery is simple, not easy.